Applying to residency is a difficult and challenging process, but it can be done. But there will also be some hard things to accomplish and get done along the way. Doc, tell us, what was the hardest thing for you in this process of applying to PEDO residency?
Gosh, I would say it was in like a short answer, culminating all of the sort of like intangibles, the hopes and the dreams, and then putting into something that felt concrete and something that, the admissions boards of the programs I was interested in to pursue this dream of becoming a board certified pediatric dentist, putting that into something that they could understand so they could see where I was coming from, and then kind of doing away with all of the doubts I had espoused within myself and finding my own sort of like rhythm with that. That was probably the hardest part of all of this, and then just putting it into a schedule and understanding, kind of putting a timeline to that and getting my materials together. Yeah, definitely.
What's the best way to prepare an application for pediatric dentistry residency? How many schools or programs should you apply to? Uh,
Oh,
how do you get your interviews? How do you prepare yourself for the interviews? How do you rank your programs? What are some tips and advice that you should implement during this process and this journey? All of those answers to those questions are coming up as we talk to a dental student who just matched into PEDO on her way of becoming a board certified pediatric dentist. So stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and life as a new dentist. Ladies, gents, it's a new year, which means new things to be thankful about, but also new things to put on your action list, right? And hopefully it's one of those things where those things that you're trying to do or that you want to do, you get some tips, you have some actions, you have some strategies, and that's what this episode is about. So be sure that you are continuing to tune in, share, like, comment, and let us know and give us some feedback about things that you want to have us talk about upcoming in this year's set of episodes. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidencyChallenge.com. Yes, a challenge. We challenge you to challenge yourself to jumpstart your residency process, so that your residency application process, so that you are not surprised, you're not fearful, you're not doubtful about how you should put your application together, so that you do two important things, which is get attention and then get invited to interviews, but also get selected this application cycle. For more details, go down below or up top, which is GetIntoDentalResidencyChallenge.com, and we'll see you in the next challenge. So today we're going back to the West Coast. We've had successful not success. Yeah. There've been some successful actions that people have been implementing and celebrating and getting into residency. Today we're talking with D4, about to be Dr. Isabella Idea. And Doc, please introduce yourself for those that are meeting you for the first time, and just give us a little bit about your background as well.
awesome. Hey, everyone. Thanks first and foremost, Dr. Darwin, for allowing me to be a part of this process, for aiding me through this process. My name is Isabella Cecilia Dumlauidea, but you can call me Bella for short. As Doc said, I am a fourth year at Loma Linda University School of Dentistry. I did get my Bachelor of Science in Dental Hygiene from that same university, and I practiced as a hygienist, a registered dental hygienist, for about a year before I did go back into the DDS route. And now I really can't believe it. I'm 4 months away from graduating, and just got through that very challenging but rewarding process of match into a pediatric dental residency here at Loma Linda University School of Dentistry once again. I can't
Awesome.
believe it. Yeah.
Yeah, you are glowing, Doc. You're glowing. You're glowing. I mean, not that
Thank
you weren't glowing
you.
before, but you got a special glow now because you got this, you know, one step closer to becoming a board certified pediatric dentist by Matchins. I want to say congratulations, and we want to know all the things and um how you did it. So let's get started. Let's just jump in. Uh, Pedo. Why pedo? Why not ortho or oral surgery or just general dentistry? Why pedo?
I think I always take it back to my origins. I think of my family and of community, and I think it's not to say that any other, dental profession specialty area doesn't work with community, but I feel that with pediatric dentistry, the privilege to be able to bring a lot of my own sort of cultural values of taking care of not just one's own, but those around you, in order to build a better foundation for your community as a whole. That starts from working with our very young ones and with dentistry and setting up the foundations of health through the oral cavity, which is still very much a part of the body, and creating good relationships with our community through being an educator and someone who can just very uniquely and be very specially trained to inspire and work with those who are especially vulnerable, and those are the children of our society. I do feel that that has always been my calling. I'm the eldest in my family. I'm first generation Filipino American, and in our culture, we always think of the others in our community as almost like our family. So even if my auntie isn't really my blood auntie, she's still auntie to me, and being from a Methodist, faith too, our mantra of open hearts, open minds, open doors, that's also been kind of a big inspiration to what my passion and what my calling is, which is to always welcome others from all walks of life and to, especially, touch or impact them in a way that will leave them better than when they first came to be in contact with me. And I think through pediatric dentistry, that is a very important part of our society that is so needed, and there's so many underserved folks that need that care from the very beginning of life. And in a nutshell, that is why pediatric dentistry is for me.
Yeah, that's great. That's great. And I love that because, life starts as a kid.
Yes, yes.
Right?
Yeah.
Life starts
We all start
as a
that way,
kid, which is cool. I forgot to show off a little bit of my was it Tagalog? Is it
Oh,
Tagalog? Did I
Tagalog,
say
yeah.
Tagalog?
Your Tagalog
I was
chop.
supposed to greet you today and say "Kamusta." I was about to
Yeah,
ask you
kamusta ka
"Kamusta."
na?
Yeah, I forgot, but I guess I got to do something else later on. But yes,
No, it's all
pedo,
good.
sense of
Yes.
community and family, it
Hmm.
being your calling, and it's a story for you, right? It's a
Yes.
lifestyle.
Hmm.
And for many people who are applying to pedo, it may be something similar, it might be different, but it's a story, right?
Hmm.
And it's
Hmm.
it's your story, and it's one of the things that people have to continue to remember as you're putting together your application. You want to tell your story, right? Know your
Absolutely.
why. What are those most important things that have pushed you down this pathway, so to speak, right? Um,
Yes. Yes.
there's also a pathway of getting the application together,
Hmm.
right? Tell us a little bit about your strategies and how you went about getting your application together for PEDO.
When I was really reflecting on this, I realized that I called this my calling, right? It really was like that. I was someone who had always loved working with kids, but I didn't realize that it was going to be in pediatric dentistry specifically someday, that was how that was going to be realized. But way, way back in the day, I was like a high school student, and I thought I was going to go to a university, study biology, go the DDS route, and then get to peds that way. That is not how it happened for me. I actually did community college first. I got waitlisted to all my universities that I applied to as an undergrad student. And from there, I then did the hygiene program at Loma Linda. And that is kind of like the first foray into what re sort of sparked that interest for me. So I feel like in a way the preparation and the mentality behind like someday I'm gonna get there. There's something kind of brewing in my heart, incubated deep down inside that makes me feel like I feel like I can do this. I just need to find my way. And so I think it always went down to who is it that I can talk to that can teach me about just being in contact with those who need that kind of care. I got really involved with multiple service organizations, one of which is very near and dear to my heart, being Healing California. I would say it started as early as that as a hygiene student. Providing that service in Honduras when, I got to do that as a mission service. And we served half of our patients who were like, I think 500 patients in the totality of like a week. It was just me and like seven other dental students when I had first done this as a hygiene student. Half of those patients were kids, and my colleagues did not like working with kids, but I did. And I felt like, wow, if this is something I want to do someday, I definitely want to get more exposure. And I think from there, I sort of had this mentality that if hygiene isn't for me, maybe I can go into dentistry and see how that works. And then COVID happened. I graduated 2019 from my bachelor's program for dental hygiene, worked a little bit, and then COVID happened. And that was kind of my sign. I'm like, you know what? It's now or never. I'll apply to dental school. And I think from then, I actually thought to myself, I'm going to try to solidify myself as a very hardworking student, maybe make my name known, and even the pediatric, specialty portion of our school, and kind of get to know the faculty there. And I just felt like I was always somehow drawn into whether it was just like, oh, we need help passing out like toothbrushes to this local elementary school or something. I think I always made a point of like not being a stranger to those around me, whether or not they could quote unquote help me or not in this process. I think again it goes back to community. And I think when you're asking the formal question of like, how did I prepare for this? Obviously, I did my research. I went on Google. The usual channels, Reddit. Like, okay, who can tell me like kind of their strategy for like what their timeline was for how do you get into peds like in the practical sense? And a lot of the general thing is get a good GPA, talk to, the powers that be, things like that. But I think obviously, Dr. Darwin, you helped me so much with that process too. You gave me like a really good timeline for how to get my thoughts together. As you can maybe tell, I tend to be a very sort of conceptual, ideologic sort of person. So having a timeline really helped me a lot, and having those goals really helped me look not just like missing the forest for the trees, sort of, but like making sure that anything that I did kind of always tied back to that ultimate goal of becoming a board certified pediatric dentist. So if I was doing service work over the weekend, I'd make sure, okay, it's because it's going to help get me a lot more experience working with kids, especially since it's an elementary school. Why am I studying so hard for this test and missing out on parties with my friends? Because I want to do the best that I can to prepare for, not ever having an excuse to not do my very best in order to present myself the very best for that application process, should I feel that I'm ready to do that. And in all reality, you're never really ready. You kind of just it's consistency and it's intentionality. And I think those are kind of the general ways that I prepared for the application.
Yeah, and I think you made a good point. You many may feel like they're not ready,
Hmm. I
um,
didn't feel like I
and
was.
and you don't really, you know, you can't confirm that unless you get ready and apply.
Yeah, you just got to put yourself out there. I think that's like kind of the key with a lot of things. Um, like speak even though your voice shakes was kind of my big mantra for this time was that just you just got to do it. Like there's always going to be a first time, and you'll never get to where you want to be unless you take that first step.
Yeah, I mean, just like, for us getting ready for dental school, that first week, that first day, it's
Hmm.
like, oh my God, am I gonna be ready? Well, guess what? You paid your deposit, moved, relocated, and you're starting in the morning. So if you ain't ready now, you ain't ever gonna be ready. So
Hmm.
just go to class. Don't worry about it, right? You
Yeah, yeah,
just have to jump in.
exactly.
So it sounds like part of your application process started years before dental school.
Yeah,
At
honestly.
least as it relates to PEDO, right?
Yeah, definitely,
So
definitely.
you had some foundational things connected to once you got to dental school and said, you know what, I like the experiences that I've had in the past. I want to continue that. Yes, you may have explored some other specialties where maybe there was a
Hmm.
sense of community, but it sounds like PEDO was the one that stood out the most because of those foundational things and experiences that were true and dear to you. for the most part. That's what it
Absolutely.
sounds like.
Yeah,
Good,
definitely.
good. So, did you? So, does that mean that first year dental school, second year was when you realized, okay, I'm going to be a dentist, but I want to be a pediatric dentist? When did you decide? What year was there? Was there a turning moment or a particular time where you said, "This is, yep, pedo, this is it, and from now on, I'm going to do X, Y, and Z."
I would always sort of relate back to my first inspiration, who was my pediatric dentist. I know that's a very common thing,
Mm.
but I was an extremely anxious child, which is funny because I think when you hear me talking right now, like you can tell I'm a chatterbox. I love people. But as a kid, I think I just hadn't found my stride in my own self-confidence, and I can truly say that like the experience of and I really have to credit my parents, my own home and support system for this. They saw how much fear I had going to the dentist, and they were so supportive of me by saying, hey, you know what, this isn't a good fit for Bella. Let's go ahead and make sure that she's seen by someone who will care for her and, kind of go at the pace that she's most comfortable with so that she can get the care she needs. My mom was most concerned about my teeth actually because it was the ortho concern, of course. So I want to say it was like 7, like we had just moved from another state, so everything was new and scary. And but my pediatric dentist, I don't know if I can name drop, but I'm a name drop because she's just the best, Dr. Barzayan. She was my pediatric dentist, and I'd seen her from that day when I was 7, and kind of, I would say, got over my fear of going to the dentist. And every visit we'd have, she'd always ask me, do you want to be a dentist? And I'd be like, I want to be
Mm.
like you. And I think at the time I thought, oh, a dentist is just what she does. But it wasn't until I would say high school, when I was, no, it wasn't high school. It was actually college. It was community college. So I was at the local community college, and it was maybe man, I don't have my geography right, but I knew it was like a 20-minute drive from her office, and I was just trying to get some exposure to a
Hmm.
place that would be a good project for my oh my gosh, what was it called? It was microbiology. It was microbiology, and we were trying to like kind of discuss biofilms, and what better place to, explore that than in a dental office. But she was my dental connection, and I guess in a way that was my first foray into what dentistry looked like to me. So I would say, to answer your question, it was as early as probably 7 years old, solidified further and further each time I'd see her. And then
Yeah.
I think the intentionality and the actual, oh, I'm gonna do this was probably, yeah, as early as my, I would say, second year of dental school more than first year. First year was a doozy. I had been working for a little bit, so I was totally out of the game in terms of what it meant to study again. And so that was really hard. I experienced that self-doubt I kind of mentioned earlier of, man, am I even cut out for this? Of just even passing, to get the grades to be in the DDS program. And I think after finding my stride with that, I decided, I just have to push it to the limit and, find the resources I need to get the help I can to be the best I can be. And I realized that you don't have to be alone to be successful. In fact, you need to rely on your community. And so that's why I always take it back to that. I would say that was like really the moment I was like, you know what, I can do this. Like I maybe did, I think, one really good exam like score, and I was like, wait, I can do this. And I think that was what like set me off.
And I remember one thing also that you shared when we were putting your application together was the externships. I think you had a
Oh,
a
yes.
pedo externship or internship at the school. Share with us how you feel or felt those experiences helped you put together your application for pedo.
I would not have garnered nearly as much of the context and the understanding of what the day-to-day looked like without having had those opportunities to get externships. So the way that it worked at my school was, well, there's like, I should say that there's the formal way of getting an externship. They call it an honors program. You need to have a certain GPA. Truth be told, I was not in that GPA cutoff for what they deemed to be like an eligible candidate for the honors program for PEDO at my school. But what I did was I worked to my own strengths and made sure that I got to know all of the residents really well whenever I had rotation. I would shadow on my free time. When I was done studying, I would make sure, okay, I'm going to spend X amount of hours every week to make sure they know who I am. Once they knew who I was and I was actually on clinic and working with them, they knew who I was. And I felt that helped me actually get I should say the privilege of actually being able to shadow over my spring break of my, I think it was my, gosh, the timeline is so murky now. I want to say it was my third year. It was my third year of dental school, which is crazy. I can't believe that was a year ago. So I spent my spring break there at my school's pediatric dental clinic. And it was great because that actually stemmed from a conversation I had had with our program director, who I had talked to. And it was around match day for the previous batch. And I was telling her, I want to do this. I want to be at your program. I would love to be a board certified pediatric dentist. And she said, well, you have to shadow, you know. And I said, how do you do that? And she said, well, since you took the time to talk to me, why don't you go talk to this doctor? And so I had gotten that experience
Ah.
not through that like formal, oh, you need to apply through this specific application, but it was again my sense of like it's the community that really is the life force behind everything that we do. And I think that's so much more personable and so much more impactful than just sending in an application with like maybe a fantastic 5-star rated like resume. I think having the intention and the consistency of being there, showing up, that really enabled me to have that privilege of that externship. But in turn, I was able to see a lot of cases of patients with very unique conditions. I even wrote post-it notes upon post-it notes of like, oh, I've observed how, a kiddo with this condition might need to receive sort of a different implementation of care in order, like a modification of care to receive what they deserve. And I don't think I could have ever gotten that from a textbook or from, just word of mouth. You really had to be there, and that was a really big part of that journey. And that solidified, wow, I love this. I truly am about this. I would, it's my dream to wake up to doing this every day and helping kids, with what they need. So that helped a lot.
So key takeaway that I heard
Yeah.
was
I know it's a
the
lot of things.
fact that even though you may not get selected for a pedo externship, the formal process or
hmm
the formal program, whether it's an honors pedo, you get selected as an applicant and you go through a process, yada yada. Even though you were not selected, or even though those that are listening and watching may not get selected, does that mean that you now don't have the opportunity to shadow? Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge. And let's get back to this episode. One of the things that you said that really struck a chord is the fact that you found the community. You found the pedo community at the school and
Hmm.
just went up and started asking questions. You
Hmm.
know, hey, I really like this, Dr. So-and-so as program director. Hey, I like this as talking to the pedo residents, getting to know
Yes.
them and which led to there being an opportunity being created for you
Hmm.
directly from the school's program
Program
director of the
director, yeah.
residency program, right?
Hmm. Hmm.
And just by asking questions, just by being curious, just by, wanting to explore and learn more. So I say all that to say that there is some value of asking questions and connecting and getting yourself out of the way just by going over and maybe doing something that you may not know about or may not feel comfortable doing, because guess what? The answer will always be no until you
Hmm.
ask. And
Hmm.
and it sounds like you asking just opened up the the opportunity for you to explore, to see, to learn more, and as it relates to your application, and develop and be able to document and then eventually share experiences that you can include on your CV and also in your personal statement. So
Yes,
that's the
absolutely.
beauty and the intentionality about making sure that you find your community at your school or outside of the school, as far as other dentist specialists that are doing the things that you want to do, and going out, the importance of going out of your comfort level to explore those, to ask those questions so that you can have those experiences to help again develop your candidacy as a future board certified pediatric resident in training. So thanks for sharing that, because that's key. And what also is key once you do that is that also gives you the ability to feel comfortable starting to explore, where are these programs? Where is the program
Hmm.
for me? What are
Hmm.
some of the things I'm looking for in the program? Well, programs. Well, you don't know until you start exploring. So let's talk
Exactly.
about that. Let's talk about the ways that you went about starting to explore the different types of pedo programs in schools. They can be they're school based, they could be hospital based, they could be at a health center, they could be in private practices. There's different types of practice modalities that pediatric dentistry training takes place currently. Tell us a little bit about the number of schools that you applied to and what you were looking for in pedo programs as well.
So you just like exactly like you said, Doc, like you really don't know what you're looking for until you ask about it and just do some research. Truthfully, the best place to start was the AAPD website. That inspiration from having accomplished that externship at my own school had me thinking, you know what, I should try to do the same at other schools, especially over my breaks and just anytime I have the chance to. And usually from the AAPD website, you can actually go to each program by the state. That's another way you can kind of organize and collect your thoughts on like, is this a place I can see myself at? That's kind of like a very basic one. That helped me greatly in determining, okay, what's realistic, what's something that, speaks to me. You don't know that until you literally you click a link to that school. I'll give an example. I was mainly looking at West Coast schools at first, right? Then I expanded it to you know what? It's not the number, some like a magic number. I know a lot of people will say, oh, at least 10 schools because it's this, very competitive. I use that kind of as a marker, sort of like a starting point, like at least 10 schools I'll apply to. As I sort of like began to develop my own list of what it is I'm looking for, I'm married, so my husband is also a dentist. We actually met while I was in hygiene school. He graduated from Loma Linda in 2020. So he's actually taking over his parents' practice. And in my mind, my priority is I would love to be close to family. So that immediately solidified, okay, West Coast, or if we have family in a certain state or near a certain program, absolutely we're going to consider that. And I made sure that that was a conversation we had. That's something that every applicant should do too. Like wherever you are in life, like for us, like right now, it's not so much a priority to start the family planning, like not to get super personal about it, but he was definitely on board with what my dreams were from the start, and he's been extremely supportive. And we made sure we had that conversation of if I were to apply to programs, are you cool with me going outside of California? And it's a partnership. We have that kind of relationship where he was like absolutely supportive of that. And of course, I'm not employed, so what that meant was, okay, are you willing to support whatever that means financially when I'm traveling to go to these programs? So kept those externships to mainly California. I did go to some Southern California ones, USC, for example. They have a really great one that's like a week long. That was in itself another kind of example of the essential, just how much the importance of being really persistent and making sure that you're communicating and being yeah, consistency, intentionality, doing everything you can to make it work. I mean, I ran into a lot of different barriers that I thought would make me not eligible to be an extern there, but I made it happen. And I made sure that I was talking to who I needed to talk to and following up every day. I also looked at whether or not the residency I was interested in would cater more towards something that was more didactic versus something that was more hands-on. What's really great about so in general, you'll have programs that are either hospital based, university based, or kind of a combination. What I really liked about, for example, I don't really have too much family, but I do have friends in Texas. Their program, UT San Antonio, has a really great combo program. So they have hospitals that are like community based, kind of a more school research based, base and foundation. And how could I have known that? I networked with my faculty at my school who had gone there. I would not have known that if I hadn't talked to them and asked them what they liked about their program. And so I looked for that. Like at first I thought, oh, I'm more hands-on. I'm not very book smart. This was this like rule I was telling myself. I can only apply to hospital based. As I expanded from just hospital based, which are mainly the NYU Langone programs, to oh wow, there are really great programs such as USC, which has kind of a combo, and Loma Linda, which is a combo. That I realized is what spoke to me because I am still very much green as a student, as a new dentist, and that made the most sense for me as I shadowed there and saw, okay, this is what the residents do day in, day out. There's an element of it being sort of similar to what we experience in the clinic as dental students. But there is that freedom of, okay, you are a licensed dentist, however, and there are some clinical decision making that you might make, but that culture and what that looks like day to day, that's something you can only really observe when you're there. So on paper, on the links, you can only maybe know so much, but it's really putting yourself out there and making sure you solidify like an actual concrete time to spend with those programs that you're prospectively looking at, that will help you make that decision. And from there, you can realize, oh, yes, I do want to be in a hospital-based versus, combo versus a university-based program. So that helped me a lot.
So it sounds like you made a decision that one of the things that you were looking for, it sounded like it was kind of close to home, but you were
Yeah.
open to exploring other locations, other states, right?
Yeah.
You were also looking for, did you say a hospital-based program? What was it? What were some of the things you were looking for specifically?
All honestly, I was so fascinated by just being in a world that was just a little bit different than what we see day to day in clinic. And I think that came
Mm-hmm.
from the inspiration of being a medical scribe during COVID. I had really loved the rush of being in the emergency department. I was a scribe, so I was really just kind of following the doctor, writing down, the information about each patient that was coming in. And that already kind of solidified, oh wow, I really like being and I actually crave being in the role of I want to take care of someone who really needs this help right now. And I think the appeal of a hospital-based program is there's so much of the learning that you do hands-on, which I think is definitely more suited to my style of learning. I'm definitely much more of a kinesthetic learner. But I realize I don't like limiting myself now. Like I think this process has taught me like you don't have to be one thing or the other. That was sort of the line of thinking at first that led me to I'm only suitable for hospital based because I had this idea in my head that, well, I'm not the top GPA, ranked in my class, so therefore I don't think I would be a good fit for a university-based program. That's another really helpful thing about the AAPD is each school's kind of like personal link will give you a rundown of like what are they looking for in an applicant. You can even email the program directors or whoever it is, the registrar, to ask more about what it is they're looking for, maybe network with some people that they know that you can get in touch with. So that was something that definitely helped me narrow down from like, oh, it doesn't have to be just hospital based. And also
Right.
each program is going to have its own little culture and you're just not going to know until you get to familiarize yourself, which as you can imagine does take time. You do have to commit, devote time to like, okay, this day or this week I'm going to just be all about, I don't know, let's look at Chicago's program. Let's see what they're about,
Hmm.
and
Hmm.
again, that goes back to that consistency, that intentionality. If you're not thinking about that and thinking about what this is all for, then you're not going to find your ultimate, your future home, your future school that will teach you the things you want to know.
So was program size of concern for you?
Yeah, I would say so. I remembered at first that was like one of the first tenets I looked at was, is it going to be more important to me to have kind of a more independent learning style, or do I really want to have like a mentor I can turn to and they're not, bogged down by a ton of other stuff. So that speaks to, okay, that ratio of how many residents are there versus how many faculty are there on the floor at any given time. So that was something I definitely looked at. Whenever I would ask programs during interviews, and even like before the interview process, I would ask like, even just the registrars are like, do we have like a good faculty support or a culture of that? Um, I'll give an example of when I was externing at USC. That was the longest externship I'd had. It was a whole week. I really had a good sense of what that looked like day to day because in the clinic at
Mhm.
USC proper, you would have like X number of faculty on the floor with you for the general pediatric dental population. Then you would go to a rotation in one hospital and they would have their faculty stationed at that location. But the cultures between those would be completely different. And as I talked
Different.
to different
Yeah.
residents, they would tell me, oh, this isn't even the only hospital that we serve. We also serve other hospitals, and their processes and their protocols are completely different. So that, as compared to Loma Linda's pediatric program, which I find a lot more almost family-like, more tight-knit, and a lot closer to what I have learned to be very important to me, of having so their program in comparison is like 4 residents per year. USC's is like 10. That's a great fit for, people who are looking for that kind of size and that volume.
Hmm.
In
Hmm.
Loma Linda, it's not to say we don't have the same amount of patients. Actually, we serve a lot of underserved patients, but the culture that we work with is there's 4 residents, multiple assistants, maybe like 2 or 3 faculty, always one who's always working on research, another one who's like on the clinic floor with you, very hands-on. As I kind of saw the residents grow through their clinical, training, I could see how much less hands-on they would become, and it was really cool to see that blossom. And every resident is not going to be the same. Like some were more experienced because they had had general dentistry practice and experience beforehand, and so they were a lot less hands-on with their instructors. And for me, as a new dentist, I definitely will be looking for that guidance, but I do want to challenge myself to push myself and be more independent as I get through it.
Yeah.
So that's definitely class size was definitely a big factor in that. Absolutely.
And how many programs did you end up applying to?
Oh yes. So I did end up applying to 19 programs.
19.
Yeah,
Okay.
I wish I could tell you every single one off the top of my head. I think I used to have it just alphabetically, like it was this NYU
It's
Lango,
so
this.
it's okay. I think
Yeah.
one of the two takeaways. The first
Uh-huh.
one with regards to number is that
Hmm.
your number is your number, right? Your
Yes.
number's not going to be my number, and it's not going to be John's number. It's not going to be Tyrone's number. It's not going to be Bessie's number. It's your number based on what you're looking for, what you need, things that you want to accomplish, or at least what you think you want to
Hmm.
accomplish as far
Hmm.
as mentorship, size, cost,
Hmm.
stipend, all those factors are
Yes, that too.
factors to you, right? So
Yes.
the number is not as important as what you're, making sure that you have enough programs to apply to that will fit your needs and what you're looking for. The second takeaway sounds like that that there's very high value
Hmm.
of making sure that when you're looking at when you're trying to determine what you're looking for in programs, if you have a PEDO program at your school, at your institution,
Mhm.
you must dive in.
Mhm.
Like you must dissect and dive in, just like first semester D1 year
Mhm.
on anatomy. You got to dissect and dive in to explore to see the different components of that PEDO program, so you have some reference points, right? So then you
Absolutely.
can then compare and contrast
Mhm.
as it's going to help you develop not only what you're looking for, but
Mhm.
the types of programs and your list of programs, because you have
Mhm.
to eventually get your application out the door to these programs as well. So, um, good things to take, uh, two good things to consider as you are taking notes and actually developing your list of programs and trying to determine why these things or why these programs speak to you as well.
Absolutely.
So after submitting your application to all 19 programs, the next step is really the reason why you put your application together, really.
Yes,
The first
yes.
immediate step is to get an interview, right?
Mhm. Mhm.
Give them every reason why to invite you to an interview. So let's talk a little bit about interviews, because I know you were doing some traveling, and then
Oh, yeah.
it got to the point where you were like, you know what, I'm not going there because I just went over here and I've had some changes and I'm not too concerned about this area of the country. I want to focus more on here. So let's talk about interviews. How many
Mhm.
interviews did you get? What were the interview days like? What were some of the strange questions they asked as well? So
Oh.
how many interviews? Tell us a little bit about your interviews.
Oh my goodness, Doc. Like I remembered in the very beginning of the process, I was doing that thing where I was like checking in with my other friends who had applied, like, do you know when this interview date comes out? I was so anxious. My first one I got like early September. Ultimately, they started trickling in more and more. I think it was October, I want to say. No, no, late September. I think it was that quick. In my mind, it feels like it was so much longer. But ultimately, I got 11 invitations for interviews. I had to decline three. At our school, we have a policy where you cannot miss so much clinic that you cannot make it up within that quarter. We are a semester system, technically speaking, but because this part of the term was towards the end, you had to at that time make up any missed blocks or rotations that you had. So that was an added challenge to my decision making as to, okay, is this interview that I was invited to, is this something that looks like I can A, find value in, and then B, I do still have my first goal of graduating, right? Like that's the tricky part when you're a student is I'm making the assumption that I will graduate on time and this is my sort of like realistic side of me coming out. Like, no, like we got to make sure that we get these requirements in. So I was looking at that and I was missing a lot of clinic because those interview days, it wasn't just a day, right? You have to think of, okay, am I staying in a hotel the night before? Can I feasibly, get there like in the morning and then make it for whatever scheduled time I have? You were asking about what the structure of those interviews were. So um, for some programs, it would be as simple as this is your scheduled time, this is your day. That would be, of course, after they've handed you the email, and then you decide between the days that they give you, hey, like we have this day and this day, what works best, and then they would give you whatever time. That was one way that they did that. Another way that with other programs was they had this style called multiple mini interviews. So that would be an entire day of activities. So, that would entail not just the entire day of activities, but usually a social. That social could either be that same day or the day before or day after. I would always try to opt for because of the travel. And again, like I said, I applied to many West Coast schools. I would fly in. Usually my mode was to just, okay, I'm gonna get in the day before. I'm gonna just settle in. I'm gonna chill. I'm gonna make sure I don't have to rush to the place I'm getting to. I'm gonna mentally prepare, go to that social because usually the social was like the night before. That was really key. Make sure again you're really diving in, talking to everyone around you. You don't want to be so business and like rigid that you can't have a conversation, but showing your personability and your interest and your curiosity, I think that would go a long way because the next day would be the interviews. And in that multiple mini interviews sort of style I was telling you, they would call it like a speed dating type. So so what you would do is you would have different rooms with different interviewers, and they would give you like anywhere between 5 to 15 minutes to answer a question. And then you would be routed over to the next interview question. That would be the entire day, or it could be just in the afternoon or in the morning, depending on which slot you were in. And then the other part of the day would be a tour, perhaps, time with the residents, some socializing, just different things you could do while waiting to be seen for your interview. So that was kind of the structure of that. In terms of preparation, I kind of touched on this already, but I would always make sure that I was in the headspace to interview. I wouldn't be shy about making notes for questions that I would anticipate, like why pedo, or tell us a little bit about yourself, or what are things you like about our program that drew you to us. Those were things that helped me prepare too. Just getting in that zone of, okay, I don't have to memorize a script. You don't want to do that. That's like too polished. But you wanted to completely draw it back to what is the reason I'm here for. Always bring yourself down to that, ground yourself. That was kind of the key to my preparation process. And then I think kind of a third thing I didn't really account for, but something that helped me so much was I used to be someone who had kept this dream so close to myself. I didn't tell anyone about it. This was the time that I actually started, I wouldn't say spill my guts to, but I really leaned on my friends. I leaned on my spouse, my family. And I was telling him, hey, I'm going through a really hard time. Like, I don't want to call it a hard time, but it was a challenge. Like, I'm going through this process. And if you can just keep me in your thoughts and in your prayers, while I'm going through this. And that helped a lot too. Like, I was very lucky to have that kind of support system where I could plan these things and be able to take off from clinic to do these interviews. And that was a wild time now that I think about it, because that duration was from October to November for me, because my interviews, they didn't go past December, the way I scheduled it. So that was my experience.
Yeah.
I think you asked too
Now,
about questions, right?
questions. Yeah. Now, thinking
Mhm.
back on those 8 interviews
Mhm,
that you
mhm,
went on, I think it was 8.
mhm.
Yeah. Um, what do you remember being like the 3 most common questions you heard?
Oh man. For sure the why pediatric dentistry, that was a
Right.
really, really common one.
Why
Um,
pedo?
I'm thinking of this was a tricky one, but it's a very good one to have in your pocket. Always know what to you have something to talk about when they ask you, what is a challenge you overcame and how did you overcome it? That's a really good one.
Hmm.
Um, what else was a really good question they would ask? Of course, the strengths and weaknesses, like what are your strengths and weaknesses and why? Um, why did you choose this program? What are the most important things to you? That was a tricky one because I would find myself in a situation where, I would very candidly talk about my, being married to someone who is a practice owner, and they would ask, "What are your priorities? Like, would you up and leave where you are currently to be at this program?" And I would have to be very truthful and authentic and honest to what I felt and what I valued. And at that time, because me and my husband had established like this is just, it's a 2 year thing. One of the programs I applied to was 3 years. So that was something that we had to converse about was, are we okay with this if this ends up being the case? And that
Right.
was that was something that I definitely had to prepare for was like, yes, I value family. That's usually the first thing I value. But I think that you can definitely spin it to this journey, this dream I have of becoming a board certified pediatric dentist will be in service to the family I am planning to have someday. And the culture I have is so supportive of that it does not bar where it is that I end up if that program ends up being the best fit for me to become the best board certified pediatric dentist I can be. So I think being just completely honest about that, but also remembering to tie it back to why it is that you like that program is a very, very key thing. Like, don't lose sight of that for sure. So
Yeah.
those are very big
That's
questions I remember having.
and I just remember something that you just said that I think is
Hmm.
important for people to understand and uh to have the certain mindset about when you go into these interviews. You said 2 things. Truth, being truthful.
Hmm. Hmm.
Second is authentic, being yourself, right?
Hmm.
Be true to yourself by being authentic and sharing that. Because guess what? They like you on paper. Now they want to like you in person.
Hmm.
And you want to make sure that they know who they're going to be getting in person when they rank your name on the match list, right? So
Absolutely.
and you want to be yourself. You don't want to be somebody else,
Hmm.
and then have to go to the program and be somebody else when it's really you that you want to present, but you are giving us somebody else. Like, be
Hmm.
authentic, be your true self, because that's the person that's going to show up every day
Yep.
for 720 days for these two
Yeah,
years of this PEDO program, right? So
exactly.
very important. A great tip as far as being truthful, sharing, some things about yourself because
Hmm.
we don't know you,
Yeah.
right? You know
Yeah.
you best, but your job is to give them every reason why they should select you. And part of that selection is you selecting to share components about who you are as a person, and being authentic about that. So that's cool. Cool, cool, cool. So, um, those 8 interviews, can you share and
Hmm.
give people a little bit of an idea as to where you interviewed at, for
Yeah,
those if
yeah.
you can remember? I
Yeah. I mean, oh my gosh, like it was so funny. I was at a concert when I got my first invitation. I was like, "Oh my gosh, like this is the best day of my life." So I got an invitation from NYU Langone, Hawaii. I was not unfortunately able to make it because it happened to land on the day that we had to be at school. It was mandatory. There wasn't really enough notice I could give my school too because their policy
Yeah, I
was
remember that. Yeah.
and so I had to, and Doc, thank you so much for your advice with how to, professionally handle that situation, which, that can happen to anyone, I think, in this candidacy process is you may not be able to make it. You might be finding yourself in a bind between two schools, and you just have to be true to yourself and like what it is that. So my priority again is like I need to graduate. So I need to, I'm still a student. I have to do what is expected of me as a student. I had to tell Hawaii, hey, is there any way that you could, give me another date? And at that time, I believe they just were not able to, and they wouldn't do virtual. And that was just, in a way, that was my sign that it just was not meant to be. So that was my
Mm-hmm.
first. My next one was NYU Langone Yakima in Washington State.
Mm-hmm.
That was awesome. That was my first official interview that I actually attended. They had such a great they had a culture of just like we are going to train you to be the best and brightest. They had a lot of similarities actually to UW, which was another I think that might have been my third interview actually, the University of Washington.
Okay.
That was the one that I had the first multiple mini interviews experience with that like speed dating sort of style. I think that was my and then what was my second one? Las Vegas. It was UNLV's program. That was really nice. It was so interesting because one of my mentors at my school actually had gone there,
I've
and then
gone there.
she's
Yeah.
now still faculty at our school. So it was interesting going to UNLV's program and then seeing, oh my gosh, there's so many similarities with their philosophy on how they do things, and that was really cool. I really loved they have so many latest and greatest technologies. They're so what I remembered was just how candid the residents are. That was something that was really fun too. On these interviews, don't just like go for the interview. You're there to talk to the residents. Like you're there to
Mm-hmm.
really get as much as you can. Like you paid for that flight, the transportation, the
Mm-hmm.
time to be there, like get everything you can out of that. I think that was like my second or third. And then my fourth one, oh my gosh, let me see if I can remember. I think it was UCSF's, and then after UCSF's, it was USC's, and after USC's, Loma Linda's, and then where else? Oregon, Science
Tough.
University, and then where else? Oh my gosh, there was eight. I
I
think the
think that's 8.
final
Oh,
one.
oh, oh, no, no, no. That's 7. That's 7.
Yeah, I
Because
know there was an eighth one, and I'm just blanking on it. Oh my gosh, there was definitely.
that's fine. That's fine. I'm just trying
Yeah,
to.
yeah,
We just want to
but
give people an idea,
just an
especially
idea.
for
Yeah.
those that are considering programs on the West Coast, right?
Oh, SD. It
Um,
was it was NYU Langone, San Diego. Yes.
San Diego, San
It was
Diego.
so
Yep.
relaxed, it didn't even feel like an interview, I'll be completely honest. So if y'all are wanting to go there and you're looking for something a lot more kind of relaxed and laid back, I would say that was definitely the most laid back of all. It was my last one too, though, so maybe that was why I was just like so, polished at that point.
Yeah.
So,
So after you have at the point that you've have these interviews, and you had 8 of them, again,
mhm.
congratulations on that because
Thank
that's a
you.
task, an accomplishment in itself. Then you've got to, take your glasses off, sit down, And now you got to go, all right, now I got another job to do. Now I got to rank these programs. Tell us a little bit about how you made the decision to rank programs
Oh, good.
after going on the interviews and getting a chance to see the culture, see the places, meet the people, talk to them, smell, visual, I mean, like all of that, touch,
Yeah.
tell us how you were able to put it all together to come up with your rank list. What were some of the things that stood out that helped you rank your programs accordingly?
Definitely the culture. I was thinking to myself every time I would, land at the location of where it was that I was at. I would think, okay, let's imagine this is like a Monday in the middle of, I don't know, like March or something. You're heading to clinic. How are you feeling about your life at that moment? Are you happy you're here? Are you like, "Ah, I have to go to, like I have this patient or that patient?" Like putting myself in that, perspective of if this was my everyday, would I be happy? Am I excited to learn? Am I going to get what it is that I am looking forward to receiving from this program? That was a big thing. When I say culture, I speak to if I'm having a particularly bad day or a really anxious day, do I have, the kind of support and the environment that would enable me to get through that kind of cloudy part of my day? Talking to the residents at each program was really helpful because I would just kind of ask them like, yeah, so what does your day to day look like? Do you go to the gym? Do you have time to do this and that? And that would kind of help me envision, okay, can I lead the lifestyle that I want to live? Something that really motivated me was like, I definitely want to have an element of that work-life balance, but I'm also okay with really hitting it, pedal to the metal and committing myself to a program. So some residents that I spoke to at different programs would be like, I'm not trying to go through school 2.0. I'm just trying to get some experience, get my certificate and go. Other programs that had like a master's, if you declared that as part of your, interest. For example, the 3-year program I applied to, they have either a master's in public health or I believe it's the master's of dental sciences. And so those would kind of gear you towards, okay, if you're going this pathway, this is how it's going to look. That helped me rank a lot because I thought, um, is this the kind of educational experience I'm looking for? We were talking about stipend. That was a huge part of, and I didn't really expand on this too much. When I was looking for schools, I was looking for, okay, this is going to be more money, this is going to be more time. Am I going to be able to receive some sort of, compensation for what I'm doing? And not to say that it's all about the money or anything, but your lifestyle can definitely be shaped by the kind of philosophy that program has. And if they are paying you, depending on the program, you are considered either like an employee of that hospital that you're at, or you are recognized as like you're a dentist, you work at whatever facility, but you do receive some sort of stipend. And so that kind of shapes the way that you are treated in that program. Other programs, they might not give you so much of a stipend. It's more tuition based. That again, that's speaking more to that university experience. If you're more comfortable with that, then that's something that helps you rank. I remembered being at a crossroads between whether or not I wanted to rank UW higher than San Diego because both were like in location and culture so ideal to me. Besides, my number one. But it was interesting. I was really looking at like where do I see myself being like really excited to get into? It was a combination of that. It was also a combination of am I happy with the day to day? What are the expectations that they have of me as a resident? What kind of exposure am I getting to the things I'm really passionate about? One thing I'm really passionate about is working with cleft lip and palate patients. And so that was something that I wanted to make sure I was getting out of my programs. Does this have a very strong exposure to patients with developmental disabilities or other special healthcare needs? Which, that kind of ties back to what I'm really passionate about with the community, which is that there are vulnerable populations that, even my own cousin, she was served at Loma Linda and USC, and those personally spoke to me, and that was why I ranked them so highly on my list. And so, yeah, it's kind of a mixture of things. Everybody's a little different. For me, of course, on paper, it was like location, as long as it's on the West Coast and ideally in California, that would, be first on my list. And that's why, again, like with UW, that was so hard because I'm like, wait, in my brain, I'm saying I want to stay in California, but I really like their program and their culture. So why is it that I want to rank them higher on my list? And you're
Yeah,
really going to be surprised at yourself at what speaks to you that you will not really realize until you're actually there. That's why externships are helpful too. You can kind of get a vibe
yeah.
before the interview. But take notes as soon as you're done with your
Yeah, I was
interview.
gonna say,
Make an
take notes.
Excel
You gotta
sheet.
take notes
That's
because you're
exactly what
not
I
gonna
did.
remember. You're not gonna remember. I
Hmm.
remember we talked about it too,
It's so
because you're
true.
not gonna remember. You're not gonna remember
It's
everywhere
a
you go and
blurry.
what you see. Like, and sometimes you won't even remember the day of, just an hour ago after you left
So
the
true.
building. But
It's
you should.
exhausting.
You should sit down, go back to your hotel room, and write down. Reflect,
Everything you
have a journal.
remember.
That's why this journal is so important, right?
Hmm.
Reflect and do an assessment, do a self-assessment. So a lot of things that went into the rank process, and
Absolutely.
and all of those things will influence where you put the programs. All right, so now we're going to see where you put what and where they put you. Meaning, we're going to do the reveal. We're going to reveal where you're going to be going and doing
Yes.
your training, and then we'll
Mhm.
talk. I have some questions about that program as well. So
Yeah,
first,
absolutely.
share with us where you're going to be going, taking your talents to become a board certified pediatric dentist.
I'm going to be a pediatric dental resident at Loma Linda University School of Dentistry, class of
All right.
2027.
Yes, yes. Congratulations,
Thank you
congratulations.
so much, Doc. I really
Yeah.
could not have done it without your support. Truly,
Oh,
truly.
you're welcome. You're welcome. So, you know this program probably a lot more intimately than others, probably because this is your home
Yeah.
base of your dental training and your hygiene training too, right? Did you do hygiene
Mm-hmm.
there too? So,
Yes. Yeah.
what are some of the things, or like the strengths of the program, that you're really excited about training at Loma Linda? Just share with us some of those strengths so that people who are listening can get a better idea as they are looking for different programs and looking for different things that may excite them as well.
I would say we have some of probably the best, I'm probably a little biased, but research background. Our school presents at the California Dental Association's research poster project competition probably every year for as long as even when I was a hygiene student back in like 2017, I remember us like always placing. And there was always like pediatric dental residents presenting their research. So that was something that spoke to me because as someone who looks to solution oriented ways of treating our community, and speaking also to my passion for, diversity, equity, inclusion, serving the underserved. Loma Linda is not only locationally so close to many federally qualified health centers, so you get that exposure and the kind of patient population you receive is also extremely like in need of what you have, of your time and talents, but also your faculty are there to support you and they dedicate like basically all of their time and talent to you. So that's a big thing. Some of the programs that I looked at had lots of faculty, but many would be kind of like volunteer faculty. So they would be in private practice and then spend some time in the clinic. So then that continuity of care that you might have with like a recall patient, something that I really realized was so important to me was I want to make sure that they, especially like, let's say you have a patient that's on the autism spectrum disorder, that, desensitization to the dental environment is so critical, especially in terms of having comfortability with who they're seeing at the dentist. So if you're at a school where, or a program where you have faculty that are constantly there and it's a familiar face, that kind of familial setting is so crucial and key. And I think that's something that really spoke to me. That is a big strength as well. So you're talking research, you're talking that familial culture. Something that's still really unique is our program director, Dr. Chen, is the pioneer, one of the pioneers of the PNAM appliance. Let's see if I can remember the entire. It's the appliance that is used to mold. Um, the soft tissue structures of little kiddos, like usually 10 weeks old, that have cleft lip and cleft palate, and it helps their surgical outcomes when they do surgically resolve that cleft lip and palate by bringing those soft tissues together. So that is something that we don't just use a scanner for. Not to say that scanning is bad. It's just we really do go back to the basics and make those appliances ourselves with lab work that we do by ourselves. So when I think of in the context of my future as a certified pediatric dentist, I know I will have the confidence to fabricate appliances for kids that really do need that space maintenance and that setup, that foundation for life to be able to receive good dental care as adults, and especially those that really really need it. So that's something that's extremely strong too. We have like a really great foundation for that. I know I would be able to tackle those kinds of challenges in future practice, and also just like the exposure to the hospital, the children's hospital is right next to the school. That's not unique to Loma Linda, but I do know that the whole person care mentality of Loma Linda. We are in a blue zone, so we kind of look at the whole body, not just like the mouth, the oral cavity. That is something that is realized in every aspect of the training. And I can say that for sure as someone who is a dental hygiene student there, is currently a DDS student. And so those are definitely, I would say off the top of my head, like really big strengths of the school, for sure.
That's awesome. Two questions. The size of the program, and is it stipend based or is it tuition based? How's that set up?
It is tuition and stipend based. The size of the program is 4 residents per year. So that really speaks back to that familial sort of culture of because I had been shadowing and getting very close with the residents as much as I could. I do already kind of know the class higher than I do, and that really helps me feel like okay, this is like a really nice sort of continuum of care because I'm getting a lot of advice and kind of just that mentorship, I think. I feel that in academic spaces, we're so inclined to believe that things need to be in their own little boxes and that, things are so like you have to earn your, which is true, you should earn your way to things. But I also feel that in a philosophy of community, being willing to help each other out and serve each other, no matter where you come from, I think enables us to better serve our patients. So I think that's something that really spoke to me too.
Yeah, no, no,
Um,
no gatekeeping. No gatekeeping.
Exactly. Exactly. Yeah, because
Open
that
it
can
up.
be
Share
a
the
tendency
information.
too.
Yep,
Yeah, yeah,
definitely can. Now you
definitely.
said tuition and stipend base. I missed.
Yes,
So
yes.
how does that work?
So
That sounds unique.
it is. Well, you'll see that there are I would say the private institutions would have something very similar. So you would be paying some amount of tuition. So some schools would have you pay the first year, and the second
Mhm.
year you would receive a stipend. The program I'm particularly thinking of that has that specific situation is actually USC because the second year you are actually recognized as a hospital resident at whichever rotation you are assigned to. At Loma Linda, you do receive that stipend throughout your 2 years there, if I'm not
And what's the
mistaken.
stipend there so people can add it to their spreadsheet so they know? Do
So
you
it
know what the
varies
stipend
by
is?
the year.
Okay.
Something that was really actually really this is kind of like um it's insider information, but at UW, whatever's reported on there, actually, I think this is true of all schools. Whatever's reported on the website, especially if they're federally funded, is subject to change. So let's say that on the website, they'll say your stipend is like 50,000 if you're out of state.
Hmm.
Like what's great about, for example, University of Washington is they would have a union that would fight for making sure that, residents are paid like well. And so actually the stipend is higher and your tuition is actually a lot lower than the 50,000. That just kind of depends. But at Loma Linda, I believe it's like whatever $700 times the quarters system. So a lot lower than the like average of 60,000 to 80,000 per program per year. But again, that's speaking back to are you wanting to be at a hospital base where you're pretty much guaranteed a stipend versus like if you
Hmm.
want a combination university hospital based program, you're more likely to find that they do require tuition. And that also goes back to if you're going to a program that has a master's degree or in addition to the certificate that you are challenging, that is something that would require tuition as well. So I
So
think
the
that, mhm.
Yeah, go ahead. I was gonna say if your program, so is there a master's program as well?
Yes, Loma Linda is matched. I think I'm so
Masters,
bad at
masters, masters,
Masters, they
masters.
do have a
Yeah.
yes. So I still have to ask about that because they have changed a little bit of the protocols. But what I understand is you can declare your interest in a master's should you have accomplished certain requirements to show that you are eligible for that. So I think that goes back to if you're able to keep up with your clinical cases,
Hmm.
research, journals.
Hmm.
I think we're pass fail now, but I'm not sure how that's going to work for the following year because we just became pass fail as a university. That was a big deal. The medical school just went pass fail, so now we're probably going to go pass fail as well.
And
Um,
last question about the program. What's the tuition that residents have to pay? Is that also varies?
It varies by the
variable?
year. I think this year it's like approximately 80K per year. So that was something that we had to consider too, was like, okay, are we willing to, if we're applying to this program, be okay with the fact that we probably need to take out another loan or find some other financing option and plan to take care of that tuition. So that's something you can always apply for scholarships like you do with any other, program you would do. But that is the stipend and the tuition. Hmm.
So stipend was is going to vary, but once you
Hmm.
apply the stipend to your tuition, the
Hmm.
tuition won't be as much as $80,000. It'll be a little bit less of that,
Yes, it'll be
a lot
less.
less than that, because it's going to be offset by your stipend. Well, all of these things are good questions and information to have as people are developing their programs and list and try to make some decisions as to things that they're looking for and things that they're willing to do or maybe not willing to do
Right.
depending on master's tuition, postgraduate year status,
Mhm.
et cetera. So, well, again, congratulations. I know you're excited. I know your family is excited. And
Yeah.
I'm in the program. Dr. Chen's probably excited too, I'm sure. And all the
Oh,
faculty and attendings knowing that they got a homegrown person that's going to stay at at the school and be trained under their tutelage. So again, congratulations. I know you're so excited. It's been a
yeah.
long process, right? A long process.
Oh yeah. Oh yeah. Yeah, like I said, like it for some folks it might be like, "Oh wow, this is the time I need to start applying." For other folks like me, it's been something I've been dreaming of forever and I'm like, "Oh wow, the time is here. It's time to go." So, but we made it. All
Yes,
thanks to
yes.
you. Thank you.
So you're welcome. So now we made it to the part of the episode where people really like also because this is the part they hear about some tips and
Mhm.
strategy, things that they can implement or things that they find out that they should be implementing.
Mm.
So knowing what you know now and the
Mhm.
process that you went through, and going from 19 programs to having 11 invites to going on 8 interviews, knowing what you know now,
Mhm.
what are some tips, advice? What are some top things that people who are applying to PEDO right now or
Mhm.
getting ready or considering applying to PEDO? What are some of the top things that they must do right now? What are those things?
I would say something that helped me a lot was try to develop a timeline for yourself. Like, don't just say you're going to do this and then not really have a plan of action. For me, like I said, I tend to be so much more, idealistic and just things will work out. Like, I definitely needed to have a timeline. So take it in bite-sized chunks. There's kind of the main critical parts of the application, which are finding the schools you want to apply to. So that's a really easy kind of easing into it. Look at some schools have like a YouTube video explaining what they're all about, their mission. That's like a good way to kind of start from there. Shadow your school's program. If your school doesn't have a PEDS program, look to your mentors, look in the community, ask a local pediatric dentist if they would be willing to have you shadow them. You can make connections that way too. I've definitely done that. I actually something that I always had to remind myself of was actually during the second to third year of school, I was working on the weekends as a registered dental hygienist because I had found my stride with juggling school and my leadership org responsibilities. And I think what had always drawn me to that was because well, A, wanted to be able to make some money to be able to pay for interviews and travel. That was something I was already thinking about in my second year. And then secondarily, the office I worked at was a Medi-Cal office, so we saw a lot of underserved patients. Actually, mainly were Spanish speaking, and especially since I was planning to stay in Southern California, where we have a predominantly Spanish speaking population, very underserved folks within that population. I wanted to make sure that I was practicing my Spanish as well. So that was something. Look into what your vision is for what you want to do as a future specialist. For me, that's to be that bridge for people who don't otherwise receive that care and attention. And I think that has been so rewarding too. Seeing myself change from only being able to say a few phrases in Spanish to I can actually flesh out whole treatment plans with my patients now who are mainly Spanish speaking. That helped me a lot. That was like my edge in a way. Look for something that not to mean like you have to be different than who you are, but find something that is your why and then work towards that why with different strengths that can set you apart. I think the more that you expose yourself to different things, it might be exhausting to have to juggle. Oh, a student, I have to do all these things. Yes, but like, what is going to set you apart? For me, I made sure I was really involved with my leadership. I spoke to our capital in support of establishing like facilities for special healthcare needs patients throughout California and dental deserts. And that was something I could speak to in my interviews about, and in my CV and in my personal statement about like why it is that PEDO is a really great way to continue that fight for expanding access to healthcare for these patients. That's another really big thing, finding your why, finding the ways that you can support that. And like Doc said, have a journal. An Excel sheet is really great, like comparing your schools. You might be surprised that, like, for me, at first, I really didn't think Loma Linda was going to be my first choice. Like, kind of as a quick aside, I remembered feeling so discouraged in the beginning because of my GPA. I was so sure that I wasn't going to be a good fit. And I found my own way. And I really encourage you to look at finding your own way too. You don't have to do this prescribed. You need to have these stats to be, a good candidate. A lot of the time you'll find your own strengths are the way that you find yourself where you are. And that's really, to this day, I'm still pinching myself as to like, wow, I didn't think I would get to the school I've been dreaming of, and here it is. That is something that helped me a lot. Speak to your strengths and just work through it and be intentional, do it every day, find something that always draws back to it.
Now, when you say find your own way, you had to find
Mhm.
your own way.
Yeah.
Please share, just quantify what that means to you, because people might hear that and be like, "Well, I don't know my own way. I don't know what she means. I don't know what way." That's what I'm trying to find out. Like, what does she mean by that? So, what do you mean by find your own way?
One of the most reassuring things that I found in my interview process was as I was getting to know a lot of my future colleagues during these interviews, they would kind of speak to, oh, I went to this school and this was my pathway. And I found a lot of the things I was insecure about before, like, oh, I was just a dental hygienist. Like I didn't even get into dental school like straight out of university. I didn't even go to university before. That was my strength, was that I was unconventional. I was an unconventional student. I found opportunities within those to come back to my future goal. For example, something that I had, and this is why it's so important to keep a journal. I would keep journals during my hygiene school, experience of like, what are things I liked about what I did during my appointments? What are things that I need to work on? That would help me a lot because I would think, oh, yeah, I need to work on this. One of my first patients was a pediatric patient, and I used that journal entry to remind myself, oh my gosh, it's like it was there the whole time. You might not realize it, but there might be things that you would consider like maybe a failure in your life, a setback in your life that actually led you to the right place. Like had I not been waitlisted to every undergrad program as a high school student, I would not have even given hygiene a try. And then within that scope, I wouldn't have realized how much I love, the foundational aspect of what hygiene is, which is like constant education, care, inspiration for patients to take care of themselves, and then how much that ties to pedo. And so that's what I mean by finding your own way was I didn't realize how much of that hygiene identity I had actually had such a clear connection to what it is that we do as board certified pediatric dentists, which is to motivate our patients to take care of themselves, not just for them, but their families, their communities. So that's what I mean
Yeah,
by that. Find your
yeah,
strength and
that's fine. That's powerful.
thank
That's
you. Appreciate
powerful.
it.
It really talks to the notion of how you have to share your story,
Mm-hmm.
right?
Mm-hmm.
Your story,
Mm-hmm.
her story or his story or whatever. And you share that story and your pathway and understand that that is what makes you you.
Mm-hmm.
That's your way. Your way is what is the things that your experiences and the things that you've endured, your successes, your processes that have taken you along the way, from A to B or B to C or C to Z.
Mm-hmm. Mm-hmm.
That's your way, right? And it's going to be unique because you're unique, because your way is not going to be my way,
Mm-hmm.
right? My way is not going to be your way.
Mm-hmm.
So, and I think there's a level of confidence and strength knowing that Just because your story is not like somebody else's story doesn't mean that somebody else's story is better.
No, there's no such
Whether
thing.
it's conventional or routine, whether it's going to dental school right after undergrad or going into specialty right after dental school, that's one pathway. Doesn't
Hmm.
mean it's right or wrong. It just means that that's what happened to that person. So
Absolutely.
embracing the fact that your pathway, your story, and your experiences make you you.
Hmm. Hmm.
That's key.
Yes.
Well, you have definitely shed some light into this process for us. It's been very good. What's the best way for people to contact you if they have some more questions?
You can contact me at my email. I'm usually pretty good about that. It's just my name, isabella.cd.idea, like I have an idea, at gmail.com. That's a really good way for me to do that.
There you go, right there. Isabella.cd.idea
At
at
Gmail.
gmail.com. We'll put
Hmm.
that down. You guys look down in the narrative and also on the screen here, you'll see the correct spelling. Well, again, congratulations. It's
Thank
been
you
a
so much.
process. It's been a
Yes.
process to a successful match in pediatric dentistry, and you are on. Well, you've been on your way to
Yeah.
PEDO. This is just more of an official notification of you matching, right? Of you matching into
Yes.
PEDO. So continued success to you. We'll keep in touch, especially after the first, or maybe before the first year, just to see how you're
Yeah.
surviving PEDO. Because the hard part, well, the easy part is done, right?
Yeah.
It's getting in. It may not seem
Yeah.
easy, but now it's time for the hard part. Now you got to get through it.
Getting
Now you
out.
got to survive. So we want to make sure and check up on you, make sure that you're surviving and doing well. So
Yeah.
again, thanks and continued success to you. And to you that are listening, to all of you that are listening and watching, go to the next episode. Go to the next episode right now. Go, go, go.